In Fredericton, your family medicine experience can be as broad or as narrow as you would like it to be. So my practice, for instance, involves a full-service community practice of about 12 to 1,300 patients currently. So I work at a nursing home, which I started when I first moved here. I still work in the hospital doing lumps and bumps clinics as well as looking after inpatients.
You can actually work here without a specific extra year of emergency medicine training or a 5-year emergency program or anything, as long as you have shown interest in it. And when you first come here, one of the things that's nice about the program is they actually will buddy you up with physicians who do have that experience in the ER. So I work at the Chalmers, which would be our local larger hospital, but I occasionally do shifts at Oromocto too, which is kind of one of our sister hospitals nearby.
You can work in the emergency room. I've worked with people who do palliative care, addictions, mental health.
For our inpatient care, we're trending towards a hospitalist model, much like the rest of the country. And that group in itself has been very good at advocating for things that help family medicine and working together with them. Outstanding, great colleagues.
So I think one of the great opportunities in Fredericton is also the chance to work with medical learners for big chunks of their education, which is really nice.
So I think with the wealth of clinical opportunities here, you can build your practice the way you want to build it, and that gives you a lot of time and space to practice when you want to practice and have time outside of work to do the things that you want to do. There's really a ton of opportunity to design your practice around what your interests are.
I'm not scared to pick up the phone, to call somebody to get support for difficult cases, and I find that our teams all work together for one goal, the patient.
It's easy to come here and get to know everyone on a personal level. I think I knew all the specialists and all the doctors in the whole city within a couple months of training. As a new physician in Fredericton, I've been very welcomed in the community. I do feel like there's quite a few younger physicians in the community. I went to a new physician barbecue just a couple weeks ago, and that was really fun. It's nice that they put on events like that for all the new people to get together. Medicine can be all-consuming, and there's an endless amount of work to be done, so you can definitely work 7 days a week if you wanted to. But luckily, we live in a place where the cost of living is low, so you don't need to work 7 days a week. You can easily have a 3-day weekend every weekend if that's what you want. Some of the clinics that I work at are 5 minutes from my apartment. The hospital is 5 minutes. You're not spending hours commuting.
Over time, I've built it so that I don't have to do any work in the evenings at home as long as I can keep up with my day-to-day work. So my week-to-week to me is very enjoyable, and most weeks runs quite smoothly.
We're a very collegial bunch here. Our family medicine physicians, we've been working together on projects over the last few years, and I think it's brought us closer together than we've ever been. Welcoming people into that is something that we like to do.